On my term paper, I'm going to be talking about Robert Pickton and using the explanation of the social bond theory as well as psychopathy. So a little bit of background on Robert Pickton. He's actually one of the largest serial killers in Canadian history, and his occupation, he was actually a pig farmer in Port Coquitlam, which is like a very isolated and secluded area in BC. So his crime, essentially what he did was he targeted a lot of the women in downtown East Side district in Vancouver. He would lure or bait them and bring them back to the pig farm. Essentially what he did was he would rape the victim and then dismember the victim. Over the process of the 1980s up to 2002 where he was caught, he committed a total of 49 murders with intent. And the woman that he targeted in the downtown East Side district, it was mainly very targeted, and it was specific women who he believed in his belief that they were not worthy to live. They were very socially inferior to him, and that all these other women, have like some sort of social economic problem, certain types of disorders, personal issues, alcoholism, or had like a very big drug use issues. So furthermore, mainly in this term paper, two of the theories that will be used is going to be the social bond theory as well as psychopathy. And why the social bond theory is very important because it's going to be talking about a lot of the four dimensions which has been discussed in the textbook as well as in lecture that was mentioned. And mostly we're going to be explaining, talking about like attachment, commitment, involvement, and the belief that makes up the social bond theory, and really how it applies to Robert Pickton. In terms of attachment, learning about like the closeness to others, as well as the relationship building in whether it's a family or friends in the social matter. It's going to be play a really big role on why Robert Pickton committed these crimes. We're going to explore the areas of in the term paper. We're going to be talking about how kind of Robert Pickton didn't really have a lot of commitment towards extracurricular or social activities, and he didn't really have any other time to actually spend on these conventional activities. Therefore, it kind of further developed a certain amount of strain, which developed into a kind of severe type of disorder, which made him commit these types of crimes. He didn't really have much of like pro social activities, so he didn't really have much involvement in his life. So therefore, he really committed to more of this antisocial type of activity, or like committing to murder. And the belief of what he had to respect for the social norms, it was a very his belief of the difference between social inferiority and social superiority of what he had really made a difference on why he committed these type of acts. So going on, the second type of theory that was going to be discussed is psychopathy. And usually, most likely, psychopathy is typically associated with criminal offending and reoffending. So, the time frame from 1980 up to 2002, Robert Pickton committed a total of 49 murders. And over the course of every additional murder, he continued to reoffend. And psychopathy is kind of going to be one of the theories that's going to be discussed in the term paper to really explain Robert Pickton's behavior. Committing crimes, as I mentioned, he committed crimes more than 49 times in Vancouver. And psychopathy, digging more into it, is going to be talking a lot about how an individual have a very lack of remorse and a lack of concern for their victims. And this is going to really kind of explore more about Robert Pickton and how he actually would just continuously reoffend. We're going to talk about a lot about the genetic influences and environmental experiences. Now, as I've mentioned before, Robert Pickton is actually a secluded pig farmer, and and what he did is essentially he would be killing pigs or other livestock on a daily basis. And during this time when he committed, like, doing his job and occupation, killing became a very common thing on his everyday life. And we're going to take a look into how like these type of environmental experiences as well as his occupation really kind of change his belief and how he thinks. People with psychopathy also do not fear a level of punishment. That's why also kind of taking the idea of why he continuously reoffend. And we're going to explore more in my term paper, Robert Hare's 4-factor model, more of the interpersonal, affective, lifestyle, and antisocial lifestyle. That's going to really explain about Robert Pickton's behavior. So the importance, as I mentioned, social bond theory understands the development of Robert Pickton and how his adolescent and social interaction affected his growth and development from a child to adolescent to his adult life. It's going to help us learn why social bond theory and early discovery of antisocial behavior can help mitigate potential violent and deviant crime if treatment is applied early. And I'm going to be explaining 1 or 2 types of treatment plans that, early discovery can offset this type of level of behavior. Treatments scheduled at an early stage can help offset potential psychopathic development, and the influence of peers can help steer belief in either a positive or negative way. Because we saw that Robert Pickton, based on the social bond theory, that he didn't really have a lot of commitment, attachment, or involvement with a lot of peers or family, we can see how we could compare it to other individuals in society who have these types of social attachment or with peers, that they actually change their belief and respect for social norms versus disrespecting social norms. And the reinforcement of norms and acceptance of norms can shape an individual and how he defines tolerance of how he defines deviance. So I found 4 different types of empirical articles that was based on studies that really can explore more about the social bond theory as well as psychopathy. So the first one is going to be the juvenile delinquency and psychopathic traits, and it was an empirical study that was done by Portuguese adolescents by Pedro Pecoro. And it was an empirical study that was done on 543 young females in detention centers in Portugal. So how did they conduct the study was based on using a questionnaire and kind of going through the questionnaire with these 540 young males. So it was found based on this whole empirical study that younger criminals with high psychopathic traits show that they came into criminal activities earlier in their life. They wanted to commit certain crimes because they had a change in belief or a lack of empathy for their crimes committed. And there also showed that these 543 young males that were in detention centers had higher levels of conduct disorder. They were either very violent or aggressive, and it kind of led into explaining more about why they had behavior problems. So the second article also did an empirical study on psychopathy, is psychopathy and sexual sadism, and this is by Andreas, Michael, and Stephen and Joachim. This article is it talks about psychopathy and sexual sadism, and this kind of goes in a relationship on talking about why Robert Pickton would rape and then commit these type of murders, and it's kind of digs into the idea of psychopathy and explaining how sexual sadism derives from psychopathy. So psychopathic personality disorder and sexual sadism, based on the findings, share several common characteristics, such as emotional detachment from the suffering of others, or the preparedness to inflict pain or injuries. And we can tell that, from an emotional detachment point of view, Robert Pickton's family background, from the disattachment from his family, involvement as well, commitment, he didn't really have any. He was very secluded based on the environment itself. On top of that, how he committed sexual sadism also was the fact that, based on psychopathy, he wanted to inflict certain pain towards victims, and this gave him a certain level of satisfaction. And we're gonna see, based on in the term paper, we're gonna discuss how Robert Pickton, why he committed these type of acts. So this sample was done by 100 male patients whom were sex offenders in detention centers, and they were tested empirically using also a questionnaire, asking them the questions about why they would commit or act this way. So the third empirical article we're going to talk about is empirical examination of social bond and drug use among very millennials and adolescents. So it's going to investigate the relationship between control theory and the social bond scales that they developed on a questionnaire, asking the respondents, right, on self-admitted drug use and how often they would drug use based on a score of 1 to 5, very likely to not likely. And based on the results in the empirical study, it showed that there was a significant positive correlation when there's a less or reduced social bonding and more greater drug use as an alternative. Now, we can see from this study was based on 3,605 adolescents for the sample size, and it really kind of puts an emphasis again on the social bond theory on why how involvement and commitment really shapes an individual and their deviance and their level of behavior. Social bond theory and binge drinking among college students, a multivariative analysis, is my fourth empirical study article that I found, and by Keith, Timothy, and Gregory. And it's going to be analyzing 247 students in college as the sample size, and kind of investigating on the frequency of binge drinking within a week to measure. And three of the basic questions they asked during the study is how often did they drink among friends and peers, social bonds that used to explain why 1/4 of college students would go into binge drinking. And it's really emphasized on the fourth dimension in the social bond theory that have been that is really explains in detail about how conventional beliefs were predictors of binge drinking and how the involvement with your peers and other individuals can contribute you to change your level of behavior. So, how it relates to the offender and what to learn from this term paper. So, from this term paper and about Robert Pickton, we really want to kind of tie into exploring the evolution or the development from this individual at a very young age to adulthood, and really take a look in the beginning where the social bond theory is a very early indicator or really determine and analyzing how his behavior started to develop, all the way to how adulthood, where we can use psychopathy to really explain his more deviant acts. So the social bond theory explains why he reacts under certain environmental conditions or family conditions, and how really, because there was no one really there for him, or there's no family attachment or family love, that he resulted in having a very secluded life, which kind of made him turn this way. So violence occasionally seen shows respect for social norms which have never been established. And we're gonna see how like Robert Pickton, how he became very violent. As I've mentioned, no personal attachment of family, because Robert Pickton also his father was never there. He was raised in a very violent childhood with his mom, and on top of that, his occupation as a pig farmer, he was killing every day, killing pigs and livestock on a daily basis. This became a norm for him, and the social bond theory is going to explain how these type of norms kind of shaped and embedded in his mind, which, if we kind of connect it with psychopathy, create kind of really explain his overall behavior. As I have mentioned, the isolation from family and friends produced feelings of anger and increased tendency towards violence. Overall, this term paper, we're going to really explain and talk a lot about Robert Pickton and why he committed these type of murders. And most importantly, I think two of the main and important theories are the social bond theory, that can really explain the development of someone very early, and then we can use psychopathy as a second theory to really explain the evolution of someone's behavior when they're in adulthood, because psychopathy, a lot of the behaviors cannot be explained under the age of 18, and psychopathy, over people that are over the age of 18 can have really a more precise understanding of someone's behavior. Thank you.